Good morning, Gary.
Good morning.
It's good to connect with you. So I look forward to doing the training tomorrow on porn and sex addiction, working with that in therapy.
It's going to be fun.
Indeed. So tell me a little bit about you. You're a sex therapist, and just tell me a bit about you, how you work with people, how people find you.
How do people find me? Having done a career change, I guess what I've been privileged to have is having built up a reputation, so that word of mouth, which of course is probably the best type of referral, is happening a lot more. I work, probably 80% of my work is online. And so I also have a Google AdWords campaign where people can find me that way. But my website, the other different websites I'm a member of, ATSAT is Association of Sex and Compulsivity, essentially.
Okay.
And BACP, I think I've stopped the Find a Therapist bit of that. But various websites, I've got about 16 or so domain names, and all point to me. So I'm hoping that sometimes work, but people talk about, I did a Google search, so you never know which one they hit. And
So what got you interested in sex addiction?
A natural stepping stone. I think that's the only way I can answer that one, because I started life as a therapist at Relate in Bristol, and having done a good, I call it an eclectic rather than integrative, I call it an eclectic, bringing all sorts of different models together. And that really was the base of my training. And then very much couples work is what Relate specializes in. So that was naturally going to be a part of my training. And then because you're constantly working with sex at the end of the work with couples, whether they raise it or you raise it, by the way, just before you go out the door, tell me about your sex life. We're British, but before breakfast. And so, I was able to talk about that. In fact, with the couples work, even though sex is a casualty very quickly on in a relationship when there's conflict, what tends to happen is it also becomes one of the quick ones that reconnect people, bring them back together. And often you really don't need much just to help them kickstart it, and not true sex therapy. Okay. And so moving into sex therapy again was a natural adjunct to the couples work, because at Relate I was doing some really good couples work, and then you refer them on if they had a true, what we call, dysfunction. You then refer them to one of the sex therapists working at Relate, and well, this is something I should be doing and I can do. Most of the time we're talking about sex anyway at the end of the couples work. So let's do the training. So I did the training in that. So where I'm leading to is the stepping stone incremental that was just a natural next step. And so as you're working with sex, somewhere along the road is the secret that he or she has been involved with porn in some way, and that's why they're not coming to bed, and et cetera, et cetera. And also for me personally, because of some of the issues that I faced as a Christian, and the choices about helping same-sex, which of course is controversial, but helping same-sex to improve their sex life, meant there was a few casualties along the way in my journey, and therefore I took another tangent, which was to go into sex addiction work. I never saw that as problematic, because I'm not directly helping people to improve their sex life, so to speak. It's much more the fallout.
So sorry, that with sex addiction, what would people be looking out for to work out whether they're addicted to sex? What would be some of the key signs?
Wow, that's to answer that question is not the way it goes. It's much more denial, denial, denial. It's not a true addiction. It's not, I've got this beat, I can beat this. Denial, I can beat this. Look, I can stop this when I want to stop it. It's just something I do because I just do it. I can stop this, I can stop this. Oh my goodness, I can't just stop this. Oh, I can't just stop this. Oh, this is, and then the other one, which is, I'm not hurting anyone, I'm not hurting anyone. Oh, you just walked in on me doing this thing. I've been doing this for years. You've been doing this for years. So the ones that then get caught. And then there are those that on the slippery slope, just like a drug, because this is an addiction. So just like a drug, it never stays the same amount. It's increasing risks. And therefore, they take some risk which are just too far and get caught, not just by a partner, but also by an employer, or otherwise by the legal system in terms of the knock on the door from the police and the computer, mobile phone, everything is confiscated. And you're now locked up in the system for sometimes a year plus, waiting to know what charges might be brought because you've gone across into the illegal territory, and you've got the Damocles sword over your head for the next year plus as the police forensics look through your computer to find the extent of the illegal stuff, and then Crown Prosecution Service and all the nightmare that goes with a prosecution and then a criminal charge.
Yeah, and I mean, I used to work on the sex offender program for London Probation Trust, and I mean, obviously, because I'm a psychotherapist, I just felt that it was pretty light, and that there was a, you know, whilst there was an element of looking at relationships and attachment, majority of the course was made up of CBT tools, you know, the ABC thinking model, yes, which was rather limited and left me feeling like actually the root cause isn't really being addressed with this program.
Yeah.
What are some of your thoughts about the root causes of sexual deviation, sex addiction?
What's interesting is probably I then was catching up with where Keeley had already got to years before. And that's an interesting thing, is where I got to. So I was trained in the sex addiction work and I was doing the model, which is very much CBT. But I realized that I was spending a good 4 sessions doing history taking. My history taking questionnaire has about 260 questions on it that I'm asking them over a period of 3-4 sessions, mostly 4 sessions. And what I explained to them is, this is you, the little client. And what I'm doing is asking you some questions to build a profile of you from the minute you were born up to the age that you are now.
Yeah.
We're not medically qualified, so if you have a pathology in your body, we can't just, like the doctor would send you to the hospital, the consultant, the team would do x-rays, scans, blood tests, because we're not medically qualified. We can't just call you back after we get the results of all of those, give you a diagnosis. The only way we can do it is the question and answer. And so it's not just an obstacle course, it really does get to the heart of, how did this get set up in your life? Because what we recognized was, yes, you're using the CBT model to deal with, now that you've got it, let's get rid of it. But the question, which is actually where a 12-step group comes on board.
Yeah.
Actually, there's a step, and I call that the step 5 to 10. I have a problem, I need to get rid of it. I talk about, but what about step 1 to 5, which is, but how did I come by this problem?
Yeah.
And that's what the history taking does, because we know sex addiction gets set up in the early years of life. It may be dormant for many years, but something's going to trigger it out at some point when you bring the perfect storm together. Because it's all about self-soothing. So like you, I realize CBT isn't enough. Hence, I went off and did the EMDR training because I needed to deal with the underlying, why are you doing the behaviors? It's not about sex and it's not about porn. That's a strange statement to say.
That's just a manifestation of, would you think that that is a trauma, an unresolved trauma that is fueling?
It's a way of self-soothing from the event, which could be a trauma. People don't easily recognize trauma. When you hear mum and dad arguing downstairs and the little child is frightened and goes to their room to play with their Lego, well, they don't see that as trauma. But for a young child, that's a scary thing, because this is the only base that you know, the secure base of a mum and dad. When they are fighting, arguing, you know a little boy down the road who only has a mummy or somebody else. Therefore, when we fall out with our friends in the playground, we don't talk to them again. So mummy and daddy are arguing, they're not friends, they might split up. Oh my goodness. That's really traumatic for a child. So the child learns to self-soothe by moving away from where the stuff is going on into their own space. Now, it's that loneness situation, whether it's just playing with Lego. As they get older, they progress to the brain, giving them, pinch some biscuits, chocolate biscuits from the kitchen. All seems very innocent. The problem is when the brain now comes across this more intense behavior, whether it's alcohol that you take from downstairs, or you come across these images and it just gives you this sense of, and when the brain experiences the wow, wants to do it again. But when it keeps doing it again and keeps doing it again, what the individual is not aware of is the chemicals, the biochemicals, the dopamine, the oxytocin that is actually being secreted into the body. That's what they are becoming use dependent on. So they've actually become drug addicts.
It's a habit loop.
Yes, exactly the same. Take off the word alcohol, smoking, just left with an addiction. This is another addiction.
So this is just how the addiction manifests itself as sex, could be drugs, could be retail therapy, but underneath it all.
And it just looks like images of women or men. No, that's the needle to get the drug into your body. If you've got the anticipation of what I'm about to do, the heart starts to palpate with the excitement of when I get home, I'm going to turn on, I'm going to watch. That's the needle pumping the chemicals into your body as the equivalent. So the orgasm, the ejaculation, it is, I do mean it as a pun, it's an anticlimax. It's a wet squid. It's not about the sex. The best part of it is the chase and the anticipation.
And the lead up and the sneaking and the hiding.
Well, the risk taking and going across boundaries gives a wow. It gives a payback. It's gorgeous. The bubble bursts with the ejaculation. Reality sets in. Shame.
And then you're chasing the high again.
And then you'd get back on the cycle at some point in order to soothe the guilt and shame that you're feeling. You now try and find something to soothe that. And of course, you're back on the cycle going around and around.
So does that kind of self-soothing kind of thinking also translate in terms of porn, the rise of porn addiction? As a therapist myself who is interested in love and relationships, porn keeps coming back into the room with my male clients. And so what are your thoughts about that? Because I'm seeing, a definite spike, a definite increase. And, when we explore, just as you mentioned, there is usually something in the early years that begins to manifest, that gets exposed, that seems to be quite fundamental.
Yeah, she cannot compete with what he's carrying. in his head. He is carrying multiple female bodies, and now he's supposed to commit himself to view just this one body and be turned on by this one body, when before her he had got used to his own hands, his own gadgets for self-pleasure, and he got used to multiple female bodies. So his brain is now sensitized from being turned on by her. So in a sense, he needs his foreplay with porn before he gets near her often. Now that's at the higher level. So if you just reduce that a little, there's still something else that his brain needs to give him what he needs to be able to have regular quality sex with her. Hence, every now and then he needs to go back to his fix, because that's the best that his brain got used to. That's what got set up in his template early on. And what is in the template of the developing young child is what they're chasing. She can never compete with that. You've got to then move into sex therapy to do I never get it right, which is whether desensitize or sensitize. You've got to desensitize him from the multiple women's bodies so that he can now build back up with this one female's body. Otherwise, he's going to keep on every now and then going back to the best bit.
And what about men who are no longer able to have sex because they find normal sex with a woman a problem because they can't get an erection?
That's sex therapy, and that's what we do all the time in sex therapy, and that's what a sensate focus program enables us to do, is to deal with the which way round is it, the sensitized, desensitized. They become desensitized from arousal to her body, and sex therapy using a sensate focus program helps to not just desensitize from those multiple bodies, but get him ready to be sensitized to her body, get used to being able to being aroused by her body. But that's a clear sex therapy, not sex addiction program. Absolute hope, and they should expect good outcomes from that. There's no reason, because you've been doing porn for years and years, that you feel you can never become aroused by her or turned on. Not true. Not true. You can expect really good outcomes from sex therapy to get you able to be fully aroused by her.
And what's one of the tactics that is involved in that? What's one of the tactics that helps with that?
It's a program. It's a sensate focus program. So what you'd be doing is essentially right at the beginning, you'd be banning sexual intercourse. Stop doing it and just give the body, the genitals and the brain a break. And definitely get rid of performance and performance anxiety and the fear that, oh no, it's not going to stay up long enough for me to penetrate. It's not going to, let's get rid of all of that so that the outcome is not going to be that you're going to go and do sexual intercourse. Let's get it off the table. It's banned. And then we start right at the base, which is, let's learn again to understand your body. She learns to understand her body, and when you both understand your own bodies better, now you can exchange that knowledge each with the other, but you'll be doing that program together. So we would start with basic touch, ideally naked together, and you're just learning to touch each other's body for 10 minutes on the back, 10 minutes on the front, then you swap over, 10 minutes, 10 minutes. And then for 20 minutes, you just lay or sit in an embrace together, just feeling the tactileness of each other's skin. And that's it. And you do that repeatedly for a period of time, knowing you are not allowed and you can't go on to have sex. Not on my watch. You might do it outside of my watch, but not during this watch. And you build up to massage and you build and you build, and then eventually you bring sex back.
Mm-hmm. And so there's something about what you were just describing that sounds like to me intimacy.
Absolutely, which they'd lost for the sake of gadgets.
Yeah.
Essentially, I'm sure there's a place for gadgets, but Keeley, I often say to clients, before you do the Ann Summers thing, which is gadgets, and I'm not down on Ann Summers, no pun intended, but actually before you do that, learn what the big toe can do.
Mm.
What? Yeah, come on the journey. Let's learn. In other words, let's learn what this whole body that I believe God invented.
Yeah.
And interestingly enough, there's this funny book in the Bible called Song of Solomon. Whoo, Keeley, that's a hot book.
Really?
It's all
Easy.
about sex and oral sex. Oral sex in the Bible? No. I wrote a whole book on it to bring out the essence of, whoo, this book is hot. So what we get is being shown, learn what this body can do to the other person. Add any external other stuff. It is amazing when a couple decide to become inventive, what they can do with this body before you go now, because our bodies become use dependent.
Yeah.
A guy can't compete with that number of vibrations that's going through her from the gadgets. I'm not saying there's no place. Most people will have some form of vibrator or whatever, but I am saying learn what your body can do before you necessarily run off to gadgets.
Okay, because you've mentioned quite a few times about being Christian, and I think it's such an important conversation to be had, because there's a lot of not talking, unspeak about sex, let alone porn addiction, sex therapy in the church. So how is that for you, kind of raising these often taboo subjects in Christian circles as well as counseling and psychotherapy circles? What is that like for you? How have you been received?
Oh, that's really easy to answer that one. Well, we're Christians, we don't do sex. The only reason you find out somebody's done sex is because there's a pregnancy and the tummy's getting bigger and you can't hide it. I poke fun at us as Christians, Keeley. I really do. We are honestly, people. It is just on men and women's minds, mostly the men, for lots of hours of the day. But we don't really know who we can ask, who we can talk to. We try and find a couple who dare to say something. Wow, they just said something about sex. Let's get together with them and see if they, and every one of us has got the same issues, but it's almost like it's not easy to talk to somebody, and yet we try and find some safe books that we might, and people need help and guidance, and they get lost in this thing. And the truth is, it seems to be the case that it's mostly the Christians that end up with a massive amount of dysfunctions.
Yes.
Vaginismus, Keeley, which is where the vagina shuts down and it just cannot penetrate because of the involuntary muscles of the vagina just won't open. Vagina, this is my man. I love him. He's my husband. This is my honeymoon. Open. No, we ain't opening. You told us for years we're not allowed, not allowed, not allowed, and now we're married. Nobody gave us a prep to tell us to get ready. And now you just tell us to open, we can't. Sorry, that was a conversation with the vagina. It's just, it's not to say we should be doing sex before marriage, but so often the preparation isn't done very well, when for years the message was we don't do premarital sex, which is right, but we also really didn't do the prep stuff and the educational stuff. So many Christians actually have a whole lot of dysfunctions, and you're constantly seeing them repeatedly.
Yeah, and I think that's what's great about what you're doing in terms of raising awareness. So the training I'm on tomorrow is with is it the ACC?
Association of Christian Counselors. So it's just one of the professional bodies, just like BACP, that accredit counselors, and it's a professional body for accrediting and registering with.
So what advice, as we come to a close, what advice would you give to anyone who's struggling with a kind of aspect of their sexual behavior that they're growing concerned about, be it porn, be it certain practices that they're doing in secret that they're worried about but feel shamed, don't want to kind of just don't know where to go, or like, a few of my clients end up researching and taking advice from Google, which has its place, but is not always as helpful as it should be. What would be your encouragement to someone who is concerned about their sexual behavior?
That's really interesting. That's exactly where I was going to go to, which is don't go to Google, the font of all knowledge. That's the wrong place. You'll always find some others that are similar to you and give you endorsement for you to stay where you are or even go worse. You need to talk to a knowledgeable person. And it could be a counselor, but not all counselors are actually comfortable with sex.
No, they're not.
At all. And in our churches, it actually isn't safe a lot of the times to talk about sex, but you really do need to find a knowledgeable person to talk about, and you'll find, oh my goodness, you got a similar issue, you got similar, wow. And it's not just me. Because one of the worst things is shame. Shame keeps us hidden. That's what shame is, and it's particularly big in sex addiction. Indeed, I call it my mathematical formula for sex addiction. Shame plus narcissism equals sex addiction. Shame.
How do you come up with that conundrum?
We can talk about that again and tomorrow, but they're such big components. Shame keeps us hidden. The first step you need to take is to break the back of shame and undermine shame by talking to the right people, not the wrong people. The wrong people will increase shame and take you back underground. Find knowledgeable people.
Have you noticed any trends about like sex addiction and working with Black males at all? Is there anything that you've noticed?
Black males don't do counselling. I'm not sharing my stuff with busybody other third parties. It's hard enough for Black people really, but Black males particularly. And so they are an underrepresented group of people, which is such a shame, because I would say so many of us have got big attachment issues going on. The absentee dad or the absentee mum, or the living with a granny, an auntie who brought us up, or the being brought over to another country when we were really young. Whichever one has disrupted the bonding with this significant other. And so you'll know that the significance of that is that it's going to show itself in how we go on to do our adult relationships because of insecurity. And therefore we need to control, and control can take many forms, the passive aggressive or the downright aggressive. Just to keep control is because we fear somebody might do something to us to cause hurt, and it's the brain way of protecting us. So our Black males, there is an answer to so many of the problems, but we don't need two princes to tell us about mental health issues, but they ain't going to convince our Black men just because others are now going into therapy. It's the British thing as well, Brits. The Americans have a psych in their back pocket. They go and see at lunchtime, come and speak to their co-workers about it. Nothing shameful, nothing. It's all good. But
I do think it is changing, though. I had somebody say to me the other day, a new client was like, well, all my friends have got a therapist, so I wanted one too. I was like, okay.
I agreed with you. No longer do we need to go through the back door to see your counsellor. We'll go through the front door now. But it's taken the superstars, the Hollywood stars, the to give it, but it is absolutely.
You're right.
Which is right. But us Black men are still slower in coming forward. but there's other big stuff about us black men, in society. But we need
But
the black women to lead.
but do you think that that is also about class? Because I was recently interviewed by the BACP about Black people accessing therapy,
Mm,
and they didn't publish my article, and I wonder whether it was because I said
yeah,
majority. I have a lot of Black clients who are middle class, so you know, I guess my thoughts didn't really complement the agenda of the article for Black History Month, because what I was saying is I have a lot of Black clients who are middle class who are accessing therapy either paying privately or through EAP through their employers' services, and that's been one of the ways that I've seen a fair few Black males, and they are talking that the issue of sex, porn, has become quite prolific in my practice. So
that's great. But you're too radical. You tell the truth. And sometimes BACP and the likes is not ready for that yet. And so keep doing what you're doing. Don't be silenced, because there's a massive amount of people that need to read an article like that that says, wow, that's me.
yeah,
I could do something. But it's got to get an outlet. You've got to get published. So switch it to be a Batang.
very
Switch.
true, very
The
true.
message is so needed, and you representing a large black, gosh, you've got a big message to get out there, and you really need to.
Oh, blessings. Well, thank you. If anybody would like to get in touch with you, what are your details? What's your web address? How
Yeah,
do we find
web
you?
address, it's Kairos. My organization is the Kairos Center. What's great about this is Kairos is a Greek word for your appointed time. There's a time in all of our lives when it's just right. I know this is the
Oh, bless.
season. I know this is the time. And maybe this is your Kairos moment. So it's called the Kairos Center. The website is kairos-center.com.
Okay.
Email address is info@kairos-center.com. And my phone number is 0786 609 7247. Gary McFarlane.
Superb. Gary, you're also a couples therapist
Yeah,
as well.
I am. Yes, and previously for, I don't know, over 20 odd years, actually, I was a lawyer in London.
And a lawyer as well. What area of law did you specialize in?
I really was specialized. It was clinical negligence. So, interesting enough, I used to act for the consultants, doctors, nurses in lots of hospitals in London, Bristol, Manchester. And then I did a radical thing and changed sides to act for the patients, suing the hospitals, the doctors, in that. So,
Superb. A learned man, I'm sure.
good to see you. Oh, and the mediator. I'm a mediator, so I can help you with your conflicts in your relationships, even if you want to. Because couples counseling, marriage counseling, it is not about keeping people together.
Yeah.
It is about helping them to understand themselves so they can make better informed choices about what they want to do. We love it when they stay together because there's
Yeah.
children involved, but that's not our job to
No.
keep you together. Those are choices you will make.
To give people that voice, that
That's
space to be able
correct.
to be heard.
But isn't it great to go on a journey with people? It's such a
Oh,
feeling.
it's a blessed life. It's like my mum said to me the other day, don't you get tired of hearing people's problems? And I was like, Mum, you don't understand. Like, humans are absolutely fascinating. They fascinate me every
Absolutely,
single day, you know.
absolutely.
And
But
when you're trusted with, and when they trust you, and
immense privilege, immense privilege.
I have no, like, I am, yeah,
That's
it's
right.
a blessed, it
Make
is a blessed career,
make sure you're always looking after yourself.
always.
People's stuff does get inside, particularly sexual stuff. So make sure you are looking after yourself with supervision, um, and actually just a support group. So if you
Yeah,
don't have a support group of people bearing you up, get a group of people around you that just
yeah,
at a distance and they can just hold your hands up.
Yeah. Well, you know what? Just before I go, I want to say thank you so much. You encouraged me to complete my EMDR. So
Yeah.
that is so, like, I'm really pleased. I got all the 4 certificates now.
Ah, excellent.
And
Excellent.
again, you encouraged me to get on this training,
Yeah.
which I kind of just thought, oh, well, I'll try the next one. And you were like, aren't you free Saturday? And I was like, yeah, I could do this Saturday.
Right.
So, Gary, okay, I look forward to seeing you tomorrow.
Good. It's going to be fun. It's going to be fun.